process is very simple. Patient comes in, we consult with the patient regarding all-on-4 treatment or full arch reconstruction, and we take a set of digital photos, CT scan, intraoral scan, and we submit everything to Burbank Dental Lab, and they will create a smile design that we can show the patient of what the teeth will look like. They can pick their color, shape, position, and even some characterization for patients who like diastema, like my mother. So they can see everything before they even go to the operating room. This, in the past, the way we used to do it is we take an impression, send it out to the lab will make a denture. The way we do it nowadays is 3D printed, high quality material that is as accurate as it gets. And once the patient sees the smile design, they're sold because they can visualize what they're gonna look like after. And the smile design is embedded in the photo that we obtain, whether it's a 2-dimensional photo or 3-dimensional photo. And the patient can visualize the way they're gonna look after the surgery, after the treatment. And the designed arch is saved to the software, and on the day of the surgery, we proceed with putting the implants, however number of implants, whether it's traditional dental implants or remote anchorage implants such as zygoma, pterygoids, or nasal implants, it doesn't make any difference. And once we place the implants in the surgery, we'll ask the specialist from Burbank Dental Lab. We use scanning using photogrammetry technology, which provides accurate replica of the position of the implant based on accurate vectors and dimensions. This cannot be replicated by traditional intraoral scanning. Definitely cannot be replicated by traditional intraoral impressions that we used to do in the past. Once the photogrammetry scan is done, they take the scan and merge it with a pre-existing smile design to pinpoint the exact position of the implants. Whether the implants is put straight or angled up to 60 degrees, it doesn't make any difference because we can adjust the position based on how we want it to be, and it can be built into the prosthesis that the lab is going to fabricate. So, big benefit: time, accuracy, and aesthetics.